Hi guys, I welcome you all in the today's class of interpretation of blood reports. Hope you all guys are doing well. And as I promised, I'll be taking a very quick session about how do you interpret a blood report. Okay, I hope you guys are training us with the on Dr. Patho and Dr. Patho Shorts and also on our Instagram channel Pathpal. So keep in touch so that you don't miss an update regarding any class. So, firstly, as we all know, we are currently living in an era of AI. So, everybody knows what is AI, it is artificial intelligence, right? So, in this world of artificial intelligence, when everything is moving towards automation, so yes, in hematology also, these blood reports which you are generated, they are not generated by their own, but they are generated by the machines. Okay, so actually what happens, you have different kind of machines. So this is the vial. This is called the sample vial. Remember, this is purple stopper at the top. This is the purple cap vial. It has got this K2 EDTA. EDTA is ethylene diamine tetraacetic acid. That's the reagent it has for the storage of blood. And whatever it is, like if you want to have a CBC, if you want to have a WBC, if you want to have somebody's even HbA1c, then the samples are usually collected in this vial. Okay, so this vial is masked for these samples. Even if you want to have some peripheral smear for the malarial parasite, like it is the season now for MP or malaria parasite or filariasis, then also you need to send the sample in this vial. It has a minimum mark that the sample should be above that, and it has a maximum mark also on the vial, so that you should not fill the sample beyond that. Otherwise, the ratio, there's a reason why this 1.8 milligram per ml is given. So it is the concentration of the EDTA, which is according to the amount of blood sample which can come in this vial. So if you are breaching with that ratio, then your reagent will get altered, and the storage changes or the degeneration of the cells will take place in the sample. So there are certain particular things which you need to take care when you're having this sample, and maybe in future class we'll be discussing about in detail. So first thing first, this sample collection is must. So once you had done the sample collection, now it depends upon you that in which machines, if you have both like the various types of this hematology machines for the CBC, then it depends upon you in which machine you want to run a sample. So there are certain machines like in which what happens, a single sample is run. So single sample, like single sample means one sample will run at a time. Okay, so if it is a one sample at a time, then you gets the report in 20 minutes. If it does not have got any serious concern, and if the doctor does not want to confirm the findings through the peripheral smear, then the report is just done in 20-30 minutes maximum. Then another is in a machine in which 20 samples are run at a time. So if 20 samples are run at a time or 10 samples are run at a time, so it is one lot. So it takes around 60 to 80 minutes because it is the entire processing. Then obviously, then you have to check the reports that all the findings are within the normal range, and there's no concern, so that you don't have to go with the peripheral smear. If you are going for the peripheral smear for the some findings, then it will take another 1 hour. So that becomes more tedious task, because then you have to make the slide, then you have to stain the slide, and then you have to examine. So that will take the time. So this was about the machine. Now if you have a so first thing first, if you have if you're running one sample at a time, then you have got, it will take 20 minutes. If you're running 10 to 20 samples in a single row, then it will take 60 minutes. But it obviously this is more efficient, because if you are using bulk sample at a time, then your amount of reagent used by the machine is more efficient. instead of going with one sample at a time. And also one sample at a time, it becomes more tedious. So that is more manual procedure. Okay, so this was about machine. There, then look at, there are I have got two images. So this is from the Horiba. There are certain companies which provides these machines for the CBC analyzer. So the big names in this field are Bachmann Coulter, okay, Horiba, then you have Siemens or Sysmex. Okay, so these are certain machines companies which give these machine which provides us with the CBC analyzers. Now this type of machine is a three-part machine. So you have this here, this is a pen where you insert the sample. So this vial, I'll have to open the cap, I'll have to put it here, then it will run the sample and it will give me the report. So it's a one sample at a time. Okay. Now this is again from Horiba, but it is the five-part machine. So it is five part. Okay. This is three part. What does this mean? What is five part? What is three part? I'll just tell you. But in this machine, so here we will put the rack of 10 samples. So there will be a rack in which I'll place in the order 10 samples and they will be run in a single go. Okay. So this is how a five-part machines will look, right? And depending upon the, obviously they have got a different design depending upon the different companies, but it was just a basic example. Now, there are two reports which are generated through this machine. One is from different machine and another is from different machine. The thing I was talking about, three part and five part, what does it mean? I'll be explaining you here. Firstly, just look at this one report. So here you have got an RBC graph, then you have got a platelet graph, and you have a graph of in WBC chamber. So it is divided, says WBC, and it has LMNE graph and a basophil graph, right? Now, in RBC graph, it has talked about the RBC count, obviously. Every report will have a range. So every lab has their own normal ranges. You should always compare your finding with the normal ranges in the lab. Yes, we do have a standard reference ranges for all these parameters, but it varies minutely with the lab to lab. So you should always confirm with the reference ranges for that particular lab because it depends upon the locality, the ethnic groups also. So these ranges are actually modified depending upon your population. So sometimes a high hemoglobin, like a hemoglobin of 13 gram per deciliter is the cutoff for that population, and maybe it is the 11.5 gram per deciliter will be the cutoff for other population. So it varies. So that is why these normal ranges varies according to the lab. Fine. So in this RBC, what the reports it has given about the RBC, it has talked about the RBC count. It has talked about the hemoglobin. It has talked about the hematocrit, MCV, MCH, MCHC. Then these two things, RDW, CV, and SD. So first I'll be talking about this RBC chamber. So RBC here, it has given the number, hemoglobin. Yes, I need to know the hemoglobin because based on the hemoglobin concentration and the RBC number, I will decide whether my patient is having anemia or not. Then how is how his or her blood doing, or how many counts are there? So how is it responding? If they're taking any therapy for the anemia, then it is responding or not. So I need to have that. Definitely the hematocrit. We all know hematocrit is the 3 times of hemoglobin. So I need to check that. MCV, MCH, and MCHC are the calculated parameters, and yes, they are very important in deciding the type of anemia. So I have certain criteria based on which I will decide whether the patient is having microcytic anemia, macrocytic anemia, normocytic anemia, whatever it is. So this is again a very extended class. I will talk about this topic in some other class, but I'm just telling you what all our report will tell you. Okay. Then RDW, CV, and SD. Our interest is in the CV parameter because it tells the percentage of the variation in the RBC size. ठीक है. So I need to know what degree of anisocytosis, like the variation in the RBC size, whether my RBCs are predominantly normocytic, whether they are microcytic with normocytic, or the macrocytic with microcytic, whatever the picture is. So whether it has got some fragmented RBCs. Remember my last class in which I've talked about schistiocyte. So those schistiocyte, if they are present in the PS, then this RDW, I have told that in that class also, this RDW value CV will increase. So definitely this RDW CV is a very important parameter for me to know whether my RBCs are of the similar shape or sizes or not. Okay. So next thing the report tells you about is the platelet. So you have this platelet graph also. Understanding these RBC, platelet, and lymphocyte graphs is a very, very, very extended topic, and it will be. I'll be taking a separate class for that because otherwise it will be like all khichdi in your brains. So I don't want you to have that mix up of all the things. Just a basic idea what all a CBC report tells you. Okay. Now coming to platelet, look at platelet will it is not just the number of platelets, but the CBC report will tell you the mean platelet volume. How is your average platelet volume? So platelet volume is very important because what is the function of the platelet? Platelet has got all the important function in maintaining the hemostasis and maintaining the coagulation, everything like the clotting things and everything like that. So my platelet volume, the granularity of my platelet, the quality of my platelet should be good so that it could perform that function and to prevent me or for that matter my patient from any bleeding disorder. So I need to look for my platelet MPV, my platelet, how is my platelet volume? Platelet crit, it is just like the hematocrit in case of hemoglobin. So platelet crit and hematocrit are the are telling the similar things. Hematocrit will tell you about the hemoglobin, like the RBCs, whereas platelet crit will tell you about the platelet and the platelet distribution width. It's just like RDW, platelet distribution width will tell you the quality, the size is variation, the size of your platelet, whether you have the microplatelets, whether you have the macroplatelets or giant platelet, it will tell you what is the conditions of your platelet. So this is all about platelet you see in a CBC report. The next very important thing comes the WBC window. So now the WBC window, look at what all cells it is talking about in EU. So here is a percentage. It will tell you the total percentage of these cells in the blood. And this hashtag is the absolute number. What all absolute number? What is the number of these cells? Okay. So first cell it has talked about NU is neutrophil, then lymphocyte, monocyte, then eosinophil, then it has talked about basophil, and then it has something called ALY and then LIC. So look at it has talked about 7 different types of WBCs. What is ALY and LIC? So ALY is the atypical lymphocyte. Okay. So if I'm having some reactive lymphocyte or atypical looking lymphocyte, which is something which is not normal, so it will detect that. And LIC is leukocyte immature cell. So immature. So this is in normal terms, I should call it as blast. Okay. So apart from telling me the routine neutrophil, lymphocyte, monocyte, eosinophil, basophil, which are normally present in the blood, basophil is like 0 to 1% is not normally present. Huh? But these are the routine blood cells. If your Coulter is telling you about atypical lymphocytes also and the immature cell counts, then it tells you about the 7 parameters. So now it becomes a machine which is telling you about 7 differential of WBCs, right? Okay, just keep this in mind. So in this graph, in this report, we have talked about 7 differentials of WBCs. Another important thing is this graph. This graph is very helpful while you are interpreting or when you are correlating with the reports. But again, it is very extended topic. I'll tell you about this in future classes. I'll take a separate class for this because they have got a very different principle, how it is read, what does these individual dots mean. So this very standard topic, I'll take it in the separate class. Okay, so we are done with the first report. Coming to the second report. Now look at, I'm sorry for the quality, but try to understand in this report again. First thing, one very important thing is like here there was no demarcation, but in this report you have got a demarcation that it has read about something in this, and then there's a line, then there's another parameter which has this machine has read, and then it has separated. So definitely it has read 3 different parameters. What are the WBC, RBC, and platelet? Now, in WBC, this machine has talked about, firstly, in journal, it has talked about the WBC count. Fine. But in WBC, what it has talked about, LYM is again lymphocyte, second, MON is monocyte, GRA is granulocyte. Now, this is the percentage. It has given me the percentage, and again, this here it is this hashtag is the absolute number as I told you above. Okay, but the important thing is it has just talked about, this report has just given me the information about WBC as one lymphocyte, monocyte, and third thing it has given me granulocyte. Okay, but here in this report it has not talked about anything as granulocyte, and in addition it has talked about 7 differentials, and here it is just 3 differentials. Okay, only 3 differentials of WBCs it has given me this report. So what this granulocyte means, so in this machine, what this machine has done, instead of counting the neutrophil, eosinophil, basophil separately, it has called combined them and given me the report. So it has, what it has done, it has given neutro plus eo plus baso together, because all these are granulated cells, so they have got granules. So all those WBCs which have got granules, they comes under the category of granulocyte. And what this machine has done is this machine has read them together and given me the complete report of lymphocyte, monocyte plus granulocyte as 3 differentials of the WBCs. That's it. So it's a very narrow report. So fine, this is 3 differentials I've got under WBCs in this report. Now look at the RBC report. Yes, of course, in RBC report, this has talked about hemoglobin fine, hematocrit, MCV, MCH, MCHC, and yes, the most important RDW, CV, and SD. RDW, I told you, it is the measure of the variation in the size. So I wanted to know that obviously. So it has talked about all these things the same. Coming to the platelet window, it has talked about MPV, platelet rate, and platelet distribution. So fine. The only difference in the report, as we can see, is the difference in this, the interpretation of the WBC. It has given a 7 differential, it has given the 3 differential. Okay. Now, this is what determines what type of machine you are using. So I'll tell you here, if your machine, okay, or for that matter, analyzer or coulter, this what all this names we use for the hematology CBC analyzers. If your machine is giving you, it is firstly, it is all about WBCs. Okay, so it is talking about all WBCs only. Okay, if your machine is giving you WBCs as such, like if it is talking about 3 differentials of WBCs, what are 3 differentials? as we talked about, as you can see here, three differentials for lymphocyte, monocyte, and granulocyte. So what these three differentials are: lymphocyte, monocyte, and granulocytes. Okay, then this machine, so it has just combined the granulocytes like eosinophil, neutrophil, basophil together. Now this machine becomes your three part. Okay, this is what I was telling you here, that this is our three part. So this is what it means, that it will tell you about our WBCs, lymphocyte, monocyte, plus granulocyte. In granulocyte, it will not segregate whether it is a neutrophil or monocyte or eosinophil or basophil. Okay, so this is what a three. This type of machines are called as three part. Another thing, if your machine gives you five differentials, as in five differential means if it is talking about lymphocyte, same, monocyte, same as the three part. Third, instead of giving you granulocyte, it will give you neutrophil separately. It will give you eosinophil separately, and it will tell you about if there's basophils or not. Okay, so this machine is talking about the five parameters: lymphocyte, monocyte, neutro, eo, baso. They are not just granulocyte, it has split them into separately. So this five differential machines is called as five part. Clear? Look at this machine. I told you here now. So this is a five part machine. So this means that this machine, when I'll run sample in this machine, it will tell me about neutrophil, eosinophil, basophil plus lymphocyte and monocyte. Fine. So how will it look like if if you assume that this machine does not give you this data of ALY or LIC just here, then it becomes a five part report. It will not have atypical lymphocyte or the leukocyte image of cells or the blast. So that becomes your five part report or a five part run machine. Clear? Now, if your machine gives you the data about say if it tells you about seven differentials, as I just showed you, seven differentials means, again, it will tell you about new lymphocyte, it will tell you about monocyte, it will tell you about neutrophils, it will tell you about eosinophils, it will tell you about basophils. Along with that, it will tell you about atypical lymphocytes, it will tell you about the leukocyte immature cells, or the blast, because the most immatures are the blast. So what it has done, it has given you the data about seven differentials of the WBCs. It has talked about the lymphocyte also, monocyte also, neutrophils also, eosinophils also, basophils also. So these are the routine WBCs which you should see in a PF. Apart from that, it has given you the added advantage of looking at atypical lymphocyte, this as the star performer of these, and leukocyte immature cells or blasts. Okay, so this type of machines are called as seven part. So in hematology, we have got a three part, a five part machine, or a seven part machine. So next time if somebody is talking about it's a three part report, it's a five part report, and it's a seven part report, you have an idea that what does they mean by saying that. Fine. Uh, yes, I'll tell you the names of the companies. For example, three part reports, as you can see, the company like Horiba, they have this three part and five part machine. Five part is also seen in Bachmann, Coulter, and the most amazing machine, I should tell you, this seven part machine is the Siemens machines or the Sysmex one. They are very amazing machines, and they give you the 7-part report, and they're highly, highly specific machines. Clear? Next thing, yes, I told you that every lab has their own normal ranges or the reference ranges. Okay, but there is a standard protocol. We always have the standard. Yes, there are variations depending upon the ethnicity of that area. We do have some variation, but there is some set pattern from where we should know that okay, this is the set limit, and can vary from this limit to 1 to 2%. That's fine. So I need to know what is that SAT limit. This set limit is the international guidelines. So we follow the standard textbook reference ranges from the book called DAISY. So this is DAISY gives you the standard textbook of all the RBC parameters and the WBC parameters, and yes, of course, and about some the other tests also. So you need to follow them for considering any variation beyond that. So there is a limit up till which you can allow a variation to happen, beyond which you should, if you are able to see the variation, then you should have an alert that there's something wrong with your machine, and you should get your machines checked. So this was all about I told you about what are the different types of machines we have. I told you about what basic CBC report tells you, what how many parts it has. Then how do you collect, in which vial you collect a sample, and how the samples are run. In next class, I will be talking about the principles of these machines. Hematology analyzer. Like today, I just talked about what are they. So in next class, I will be talking about their working. How does the graphs? How does the reports get interpreted through them? So I hope to see you guys in the next class. Till then, I hope you will enjoy the session. And if you have any queries or any comment, do mention me on my YouTube channel, Dr. Patho, Dr. Patho Shorts, or you can keep me in touch with me on my Instagram handle, Pathwell. I will be happy to help you, and I'll welcome any more suggestions for future. Till then, take care. Goodbye.